you may have some facial hair growth in the chin or in the neck or around the mouth. With testosterone optimization, completely depends on the woman, depends on the
Your
conversions, dosing,
your
routes,
receptors.
absolutely everything. And so, again, I come back to the fact it's the old lady hairs. Welcome to the podcast with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Farida Golombiewski, nurse practitioner here at RevitalyzeMD.
So today we are going to talk about something we hear a lot about in the office when we are treating hormones or treating women in optimizing hormones, and that is facial hair. So
Or just hair growth
yeah.
with testosterone
Yes.
in general.
And we can talk about, like we say, you have the potential of hair effects. Again, hair growth, maybe where you don't want it, hair loss where you don't want it. But ultimately, androgens are anabolic. So they're actually producing hair growth or activating the hair follicle. But when it comes to women in facial hair, you may have some facial hair growth in the chin or in the neck or around the mouth. With testosterone optimization, completely depends on the woman, depends on the conversions, dosing, routes,
your receptors.
absolutely everything. And so, again, I come back to the fact it's the old lady hairs, old lady hairs, and the thought. So we get those anyhow. Like, you are gonna. Who hasn't heard of old lady hairs?
I remember my grandma picking hairs out of her chin.
Yes.
And she was not on any hormones.
Yes.
Right?
Correct. Well, way before I was ever on hormones, I would have people picking hairs out of my chin. So they would be like, oh well, like just pick it, move on. Yes. So
and then there are medical conditions that can lead to women having hair growth. I'm going to get this train back on the rails. So like PCOS or insulin resistance, right? Correct. We can see thyroid issues. We can see excessive hair growth on women. So this has nothing to do necessarily with whether or not you're on testosterone or not. It has to do with the androgens and the receptors that you carry. So if you're more likely to have dihydrotestosterone at the receptor site, you're more likely to have old lady hairs, as Dr. Durst called them.
If you convert, so when we give testosterone, it ideally stays testosterone, but it can convert to DHT, can convert to estrogen. Estrogen conversion is less of an issue with women because we're already doing that conversion. You're either on it or we're giving it.
More of an issue for men, but we monitor that.
Correct. And then DHT.
And guys, if they're not monitoring it, they should be.
They should be, correct. Because that is a bigger conversion. Yeah. And again, every guy has their normal ratio of conversion. And so you have a normal ratio, but that might change as you're optimizing. So it definitely needs to be checked. And whether a guy likes it high or low with estrogen, which is a side note, again, is all dependent upon the guy.
And conversion numbers. Correct. You got to look at the numbers, make it make sense, right?
But we did get off track again. And so back to that, when we're talking about women, that estrogen conversion isn't a big deal, but both men and women, you can get DHT conversion or dihydrotestosterone conversion. And that is 10 times stronger and therefore can lead to some side effects. And so those are but DHT can also concentrate in the hair follicle. So when you have male pattern baldness or female pattern baldness, sometimes that isn't because your testosterone's too high or even that your DHT is too high, but you can have concentration of DHT in the hair follicle, which then causes the effect.
And there are medications you can take, prescription medications, there's over-the-counter supplements, there's a lot of options to help prevent or slow that conversion.
It really depends on the person. It depends on your levels. It depends on your binding of testosterone. It depends on your metabolism of testosterone, your receptor sensitivity, your age, your dosing, your route, how it goes up. So there's lots of things, but testosterone alone is not going to cause those issues if it's monitored and followed and optimized correctly. And if it does, we're not talking about hair growth pathologically where you're growing a beard. That doesn't happen.
No.
And on your chest, you're not going to, the goal is not to do that. Like, so that's overuse
or
of
back
testosterone
hair or
Yes.
anything like
Yeah.
that.
That
We're
would be a
talking
different
about-
level of testosterone treatment. And
We're talking about a hair here and there, maybe needing a dermaplane a little bit more frequently, or plucking a hair here and there.
the old lady hairs.
Those old lady hairs, which, again, women can get that are not even on testosterone replacement.
And that is our point of saying the old lady hair. So we do have that conversation with women because I'm like, you're going to get some hair growth on your face if you weren't on any hormones because it happens. And you're going to get some hair thinning if you're not on hormones because that happens with age too. And
40% of women by the time they hit menopause already start to see some female pattern baldness. So that's a huge statistic with hormone imbalances by not replacing, just by losing hormones.
And sometimes if you are optimizing progesterone, you're optimizing, you see actually regrowth of hair. But if that continues, and again, we're looking at thyroid as well, in optimization of thyroid, not necessarily just a normal level, but you may see improvement of that. And if you don't, then those are things that we can address with some regenerative treatments. But what we're getting at today, again, the trade-off is if you do have the side effect of some minor hair growth on your chin or around your mouth or on the neck, what do you want to do about it? So one option is to not do hormone replacement therapy. That's an option. But women typically know how good they feel when they are optimizing their hormones. And so usually that's not an option.
We can adjust dose.
For them.
Right?
Yes.
So like everybody, I'd love my testosterone to sit on the higher end of normal. But for me, I start sprouting those darker, coarser hairs. So I have to pull my dose back a little bit where I still feel good, but I mitigate those negative side effects that I don't want. So finding that happy balance with your provider is really important.
It's very important. So one option, not doing it. The other option is dosing it appropriate for you to minimize side effects. You can use spironolactone, which again can help prevent the negative androgenic side effects of DHT, the stronger metabolite
Or
of testosterone.
Sapameto if you don't want to use prescription medication.
Or mineral supplements that will prevent
Nutrafol
the
is great.
Yeah.
We utilize that a ton in our practice for women to help slow down shedding and to help with hair growth.
Then the other option, though, is you can do aesthetic treatments that help with that. So you can do a dermaplaning, which is, using a blade to scrape off the vellus hairs and to
also the dead cells.
Yes. And all the dead skin cells.
Yeah.
And so
it's fantastic.
It is fantastic. Like it's an excellent treatment, and all your skincare products go deeper. You actually get everything.
Use half of them so they last longer.
Yes, it's amazing. And actually, we combine it with a couple other treatments. So then you end up with like a hydrofacial, and they suck out all the dirt and the oil, and then we do a laser as a final step. And with that triple glow that we do, like your skin feels like baby butt.
Yep, it helps with fine line wrinkles, all the good things. Or, right,
you have a baby's butt with no old lady hairs.
There we go.
It's all good.
You can dermaplane, or you can take it to the next step, and we can do hair removal.
So laser hair removal. So we go back and forth about this because it's like a permanent, again, not a permanent hair removal. It's not. Laser isn't.
No.
It's permanent hair reduction. That's the term that we like to say, is that it's permanent hair reduction. Laser will only remove darker hairs, and if you do get excess hairs, that should be, again, mild in the form of hormone replacement therapy, then it will remove them because they come in darker. You can zap them. So, but not one treatment is going to work. It would be a series. So
you got to think about hair
reducing
growth
it each time.
Right. So hair grows in stages. So you have an active hair growth stage. When you do your laser treatment, you're attacking that active stage. So a month later, when you go, I have hair, it didn't work. Well, one treatment didn't work because you got to hit all those stages. All those follicles around that one active follicle may not all be active. So then you're doing another treatment to get what's active at that point. So usually with hair removal, you're doing 4, 6, 8 treatments because you need to hit the hair at all stages, all the follicles. Now, does that mean the hair's gone forever? Unfortunately, regardless if you're on testosterone or not, the answer is no. It's not gone forever.
Correct.
It just reduces hair growth.
And so it does reduce it each time. It gets lighter. And so typically you're at least doing a series of 6. And say you get to the 4th one and you're good. You still are going to have a maintenance that you're going to need at some point. So you leave those other couple for a maintenance treatment, because it is not removing it forever, but it is permanent hair reduction. So it will reduce it, and it will reduce it permanently. It's going to stay lighter, and it's going to not grow
Thinner,
as thick.
less coarse,
So,
not
and they're
thick.
excellent treatments to get done. And then you don't have to, even in other areas, shave or wax, and because that can be painful. For mild hair growth on the face, I think the options are that, maybe even if you're doing a different area, but also just doing a dermaplaning is amazing, because it has so many other benefits as we age. For getting everything else off, you can get your retinol to penetrate deeper. You can get a laser treatment when you're there, clean out all those cells and pores when you're doing a hydrofacial. So there's, I mean, you don't have to do a hydrofacial with it, but it does actually happen to
beneficial.
come with it frequently at most places. So again, those are our little thoughts. And do most women regret having done laser hair removal? And the answer is no. Most of them wish they started earlier. So if you're thinking about it, then it's the right step to do. So those are our thoughts. Again, you'll have old lady hairs, test or no test, and you're going to have hair thinning, test or no test. Optimizing sometimes will improve that. And if the trade-off for feeling good and having better sex and having energy and decreasing brain fog and building muscle and losing fat, metabolizing faster, all of those, if I got to trade that off for a couple hairs that I was having plucked even before I was on hormones, then I'm good with that. So I'm all good. What are your thoughts?
I mean, I think you summed it up right there, right? Benefits and risk. It always comes down to that.
Yes.
So
And it's individual.
can you get
yes.
hair with testosterone? For some, not all. It's not guaranteed that you're going to get on testosterone and grow hair. You might have 1 or 2 hairs that you have to pluck.
Yeah.
That is a possibility. And there are women who get on testosterone and never have any hair issues, ever.
And there are women that get the 1 or 2 hairs and it's not tolerated well and they come off. And again, all of that is okay. It's an individual decision. We always lay out risk benefits, and it's a journey, and we're just there to guide and give you facts, and that patient will make the final decision.
That's it. And then treatment options for side effects if and when they come up.
Well, let us know your experience. I'm sure that you will have some good ones to share with us.
Oh, I guarantee there are some women that feel very strongly about this topic.
Yes.
So we'd love to hear your opinions.
Correct.
Your experiences. Did laser hair removal work for you?
And let us know if there's anything else you want us to talk about, because we're willing to deep dive into anything. Thank you.
Thank you.